Ashlesha, you can start.
Very good evening and a happy Diwali to everyone. I heartily welcome you all for today's session on the topic Infection Control in Dental Clinic with respect to COVID-19. I, Dr. Ashlesha Mahagaonkar, the creative head of Sinodent, am the host for today's webinar along with my co-host Dr. Misbah Qadri, social media head of Sinodent. We welcome each one of you for today's session. First of all, I would like to thank the founder and CEO of Sinodent, Dr. Anmol Bagaria, and Team Sinodent for organizing this webinar. Now, what is Sinodent? Sinodent is a unique platform, first time in India, and also a digital healthcare platform that provides and enhances a good relationship between patients and the doctors. It also enables a real-time appointment schedule system out to create a easy access to healthcare services and communications. Our appointment scheduling system, not only between dentists and the patients, but also medical practitioners, diagnostic labs, to radiology departments and pharmaceutical companies. Sinodent brings together the economic prices and minimum waiting time because everyone here wants to utilize without wasting time. Sinodent is here with precious healthy smile on the to create precious healthy smiles on our patients' faces with minimum wages and maximum welfare. Sinodent is an initiative that will put up all our efforts to create that beautiful smile on our patient's face always. Sinodent also brings to you research and educational programs for doctors and enhances their knowledge, skills, and keeps them updated regarding all the latest technologies developments. We are currently doing free webinars for dentists, senior practitioners from India as well as across the globe. We design and create smiles for the patients. We send latest textbooks to students and we bring research internships and scientific programs to write and publish papers and understand scope of research in the field of medical, dental and health sciences. Introducing our speaker for the day, we have Dr. Nongdamba Konjengbam, BDS from Mahatma Gandhi Medical College Hospital and Research Institute, Pondicherry, MDS from MUHS, Nashik. Currently Senior Consultant, Maxillofacial Prosthodontist and Implantologist at Imphal Hospital and Research Institute, Manipur. He is doing observership and training from Amitra Institute of Medical Science for head and neck oncology, trauma, rehabilitation, and congenital defects. He gives free treatment in Manipur for head and neck disability, rehabilitation, fabrication of ears, auricular prosthesis, ocular prosthesis, nasal prosthesis, maxilla, mandible, zygoma prosthesis in the Department of Anaplastology. He is first in Manipur to give such a complicated treatment to people for social service. I now call upon our speaker for the day. So you can take over.
A very good evening to all and happy Diwali to all. Today, I'm going to share some of my experience in this COVID-19 pandemic, some of the emergencies, dental emergencies which we face in day-to-day scenarios. So this is the picture of me treating the emergency case in Imphal Hospital and Research Institute. The patient underwent a trauma, road traffic accident. The patient got a fracture of maxilla and his central incisors were lost during the trauma. So coming to the presentation, my presentation will be focused on what are the basics of COVID-19. Then second will be regarding the dentistry, what are the do and don'ts. Then the latest update from WHO in the month of November 2020. So COVID-19, coming to the COVID-19 in the province of Wuhan, A mysterious SARS-like disease was discovered by some of the doctors, and World Health Organization announced in the year 2020 January 31st that COVID-19 is a pandemic and it has spread to other countries, and we have to be very careful regarding this pandemic. So coming to the mode of transmission. So according to the WHO, now we are not 100% sure what is the exact way of transmission, but experts speculated that mostly through respiratory tract the transmission occurs, and the reservoir is human and the others mammals. So in a country like Denmark and China, some of the animals are found to be positive. Even in USA, some one of the tigers are positive with COVID-19. So means of transmission mostly is aerosol and the formite. So we have to be very careful, extremely careful regarding this. So once we break the chain of infection, we can easily control this COVID-19 pandemic. So currently there's no medicine which can 100% cure COVID-19 or vaccine which can 100% prevent COVID-19. So our effort should focus on reducing the spread of COVID-19 and the implementation of the SOP standard protocols, which is given by the Health Ministry and the Medical Directorate of individual states. So why, who, what? Why we have to control the infection of COVID-19? Who are susceptible to COVID-19? And what are the do and don'ts regarding the COVID-19 pandemic? So who are responsible for control of COVID-19 and dental clinics and clinical setups? Number one, dentists. Number two, dental hygiene personnel, technicians, auxiliaries, and the housekeeping staffs. Then what should be done to prevent the transmission of COVID-19? The number one is, if the patient is not in emergency situation, for example, dental pain, then telemedicine or teledentistry is suggested by WHO, CDC, and the European Union CDC. And social distancing, we have to be in a distance of 1.5 meter. According to the research, when we increase the distance around 1.5 to 2 meter, the amount of spread of virus or aerosol decreases considerably. And if the patient is not well, having fever or any respiratory problem, we should advise the patient to isolate himself or herself to his or her home, and frequent hand washing. So with hand washing, we can prevent many diseases, not only COVID-19, many other diseases which is very deadly can be prevented with hand washing. Then gloves, by gloves we mean it should be sterile gloves, and gloves are meant to protect the patient always as well as the doctor, and we are not supposed to go roam around or touch anything with the gloves which is not sterile. Face masks, N95 face masks or 3-layer surgical face mask has been suggested by the WHO. This considerably reduce the chances of spread of infection, and if the patient is positive, the face mask reduces the chances of spread to other healthy persons. Then protective eyewear. COVID-19 mainly spread through the mucous membrane. Our eyes has a mucus membrane, and the COVID-19 can easily transmit through our mucous membrane in our eyelid. Then protective clothing, we have PPE, then we have aprons and others. Then instrumentation, sterilization, disinfectant. These are all the common things which we all did in our day-to-day dental practice. So with the event of COVID-19, we are supposed to make sure have a revised with a strict protocol for the sterilization and disinfection of the instruments. So dental office, disease transmission in dental office. So it may be from COVID-19 positive patient to dental team, or COVID-19 positive dental team, it is doctor to the patients, or patient to patients. And the dental community, including dental teams, families, all should be responsible to stop the chain of infection of COVID-19. To prevent the spread of infection, COVID-19 infection, following protocols should be taken care of: hand washing, bearing technique, and the needles, sub-instruments, or any other instruments which are in contact with saliva, blood, all should be sterilized properly. The technique like rubber dam and suction, high suction, they considerably reduce the spread of infections. So when the patient came to the hospital or clinic, what are the things to be done? First, we have to screen the patients. So it should be universal. Suppose if the patient is having a temperature of 100 degrees Fahrenheit, then we may suspect the patient that he or she might be positive. Then we can advise for RAT, which is rapid antigen test for COVID-19. So we have to take the nasopharyngeal swab. Then within 30 minutes, we will be getting the results. And the positive points of this RAT is we can get the result fast, quickly. But negative point is only 70% of the time we can get a correct result. 30% of the time it may be false. So we can rely 100% on this rapid antigen test. So next we have TrueNet. The ICMR, Indian Council of Medical Research, approved this TrueNet. It is a type of RT-PCR, and the advantage of this is it is portable in nature. So this can easily give the result within 5 to 6 hours. So, and the efficiency and the correctness of the result is around 96 to 98%. And the disadvantage of this technique is time consumption and the cost. So one RT-PCR will cost nearly 2,400 to 2,800. So it becomes a burden to our day-to-day or middle-class family. Coming to PPE, PPE is personal protection equipment. So it consists of protective clothing, 3-layer surgical mask or N95 mask, face shield, protective eyewear, disposable gloves. So here we have some of the pictures. Coming to this infecting whole of the body of the patients, we can use many techniques. For example, Blu-ray nano spray gun has been suggested by some of the prominent colleagues or senior doctors. So we are using Lysol. Lysol is composed of mostly benzyl alkyl chloride, which is a tertiary ammonium compound. It is like soap. So by using this machine, we will be spraying the spray. So the size of the COVID-19 virus is approximately 72 machine will create a mist of size 10 to 15 nanometer. So surface area coverage is more. So the COVID-19 become deactivated within 10 to 15 minutes. So it is one of the means to minimize the spread of infections. Then in our dental setting, we are supposed to remove as much as possible the things like magazines, models, and other things which may act as a source of infection. Then when the patient is coming for treatment, it is advisable to give a provided iodine 1% or 2% gargle or rinse, so it considerably reduce the infection rate. So here are some of the lotions, some of the gargles suggested by various experts: chlorohexidine, iodine, provided iodine, and others. So hand instruments, after proper sterilization, we are supposed to use as much hand instrument as possible, because hand instrument reduces the chances of creation of aerosols. Then if the patients came and we don't know the status of the patient and the patient is asymptomatic, but the patient want to go for elective treatment, if possible, it is advisable to postpone the treatment until and unless the patient got free confirmatory results negative of COVID-19. So rubber dam can be used to decrease the generation of aerosols. All the items like keypad, now mouse, X-ray, switch, all should be sterilized thoroughly in 60 to 70% ethyl alcohol or isopropyl alcohol. Then post-treatment, what are the things we are supposed to do? So we are supposed to wear the PPE. Then we are supposed to wash our hand properly, thoroughly with soaps. Previously, WHO recommended 20 seconds and recent update is 40 seconds. We are supposed to wash our hand with soaps properly, and we are supposed to wear a mask, eyewear, and other ground, so that they will act as a barrier to the spread of infections. Then sterilization and disinfection of dental instruments. So mainly it is broadly classified into critical, semi-critical, and non-critical. So coming to the critical are the instruments which come in direct contact with blood, mucous membrane, and other. For example, scalp blade, periodontal scaler, surgical burrs, etc. So this instrument should be sterilized properly using the autoclave and or heat sterilization techniques. So, for example, implants, surgical extraction, elevator, forceps, all should be sterilized according to the recommended sterilization techniques. Coming to semi-critical, so these instruments, example mouth mirror, they will come in contact with mucous membrane, but it will not penetrate the soft tissue. So normal sterilization, this sterilization or any disinfectant like 2% butyldehyde or 95% surgical spray is more than enough. So these are the examples of semi-critical instruments. Then what is non-critical instruments? So when the patient comes to the clinic or hospital, we are going to measure the BP. So the BP instrument is an example of non-critical. X-ray machine, pulse oximeter, phase bow, etc. So this instrument we can sterilize by using surgical spray. So overview of the nature of COVID-19, then the standard precaution, transmission based precaution, risk evaluation and PPE, and requirement for the use of PPE. So these are the next topics. So according to the World Health Organization, COVID-19 is mainly spread from human to human, and we should focus on prevention of secondary infections, because COVID-19 they do not kill the patient directly. They give a gateway or pathway for other infection to follow and resulting in the death of the patient. Then we should know what are the preventive measures, and we should implement the preventive measures properly so that the spread can be controlled. So natural history of COVID-19. So pathogenesis, reservoir, port of exit, mode of transmission, port of entry, susceptible host. So these are the questions. These are all question marks. So what causes COVID-19? COVID-19 is also known as SARS-2 COVID or COVID SAR2, severe acute respiratory disease. So who is the reservoir of the COVID-19? So it is unknown. So there are many theories claiming that humans, bats, and other mammals, but exact scientific proof is not there. So we cannot tell exactly what are the reservoirs of COVID-19. And portal of exit, portal of entry. So portal of entry is when we are breathing in the aerosol contaminated with COVID-19, we become infected, right? So then portal of exit. So when we exhale out the air, we exhale out COVID-19 virus. So according to the CDC, they've given when we take a normal breath, we expel around 5 to 10 units of viral particles. Then when we talk with our friends, we exhale around 20 to 30 units of viral particles. And when we sneeze, around 2000 crores viral particle is expelled out in the air. So because of this only, we are requesting all to wear masks in the public area or any gathering. Then transmission. So spillover. What is spillover? Spillover is a term which has been used frequently, but most of the people, they don't know the meaning. So spillover is a very easy terminology. So when the infection from one species got spread to other species, for example, HIV. HIV/AIDS is an example of spillover virus. Previously, it is known as simian immunodeficiency virus, HIV. So COVID-19 there was previously found in bats, and some of the experts told it originated from seafood market from Wuhan, and many other conspiracy theories are there. So exactly, we don't know what exactly happens, but there are many predictions, many theories. Then susceptibility of the host. So all the individuals are susceptible to COVID-19, but some of the patients who are having systemic disease, like patient having HIV/AIDS, uncontrolled diabetes, the patient who is under medication like HE inhibitor, so they are more susceptible to the virus, and the patient who is under lot of stress and who is exposed to the virus directly, they are very prone to what just more amount of infections. So what are the other families of COVID-19? We have SARS, severe acute respiratory syndrome virus, then MERS, Middle East respiratory syndrome, and others. So basically, COVID-19 has 6 family subtype, and they come under the classification of coronavirus. So mostly coronavirus, they don't cause illness to patient, but sometimes this spillover occurs and which lead to the global pandemic. So these are some of the findings of various researcher scientists. So standard precautions. So in the standard precaution is set of instructions, set of protocols, SOP, which should be followed in order to prevent the spread of infection. Example, in 1985, HIV was discovered, and the universal infection control precaution was recommended by WHO. Then 1987, they again revised only isolation of the substance or parental source of the infected patient. Then 1996, standard precaution, transmission-based precautions. As I told, standard precaution is a set of do and don'ts which should be followed to prevent the spread of the infections in the healthcare sector. So all of us know hand hygiene is a very important step to break the chain of infection. Then PPE, respiratory hygiene. Most of the patients or common public, they don't know the basic technique of respiratory hygiene. So when we want to sneeze, we should cover our mouth with a tissue paper, or we should use elbow technique, or we should follow universal infection control, sterilization, disinfection of the medical device, and we should keep our environment clean, and we should segregate the biomedical waste material according to the proper color coding. So today's lecture, we will be focusing on PPE. So PPE, it consists of hand hygiene, gloves, gown, 3-layer surgical masks or N95 masks, or protective eyewear. So when we use PPE, the chances of spread of COVID-19 become drastically negligible. So we have to be very careful regarding our respiratory hygiene, regarding our hand hygiene. So we are supposed to maintain a social distancing of 1.5 meters. And these are some of the scenarios and precautions. Fixed evaluations and PPE. So type of interaction with patients, mode of transmission of disease, amount of fluid that will be generated. For example, if I am doing a procedure which create a lot of aerosol, so it increases the chances of spread of COVID-19. So it is advisable to use hand instrument if the patient is negative in RT-PCR, then we can use aerosol. There's no problem. Then type of interaction with the patient, it may be direct or it may be indirect. Then mode of transmission of disease, as we already mentioned, mode of transmission is mainly through aerosol, respiratory tract. So we should use masks and protective barrier to reduce the spread of infections. So this evaluation and a PPE. So if the patient is asymptomatic, if the patient is healthy, so risks become comparatively less. And if the patient is having other disease like diarrhea, then the risk become higher. Then if the patient has a disease, many diseases like diarrhea, tuberculosis, and other disease, so the simple become more a threat. A risk become comparatively higher. So some of the question to consider: does the patient fulfill case definition criteria? For example, if the patient is asymptomatic, if the patient doesn't have the traveling history, if the patient doesn't belong to COVID-19 containment zone, so we are supposed to ask such questions. Then what are the agents, infectious agents, or mode of transmission? For example, does the infection spread through parental route? Does it spread through touching, contact? And is there any other contaminations? What are the procedure to be followed if the patient is positive, and what are the procedure to be followed if the patient is negative? So these are the questions which should be asked in our practice. Then general principle of PPE. So before wearing the personal protection equipment, we should wash our hand properly. Then we should follow the proper techniques, proper methods of wearing the PPE. Then after wearing the PPE, we should again wash our hand properly so that the infection is not spread. Gloves, sterile, non-sterile, many gloves, we can use any. The thing is, we should not replace gloves for hand hygiene. So many of the staff, they may think if we wear gloves, we don't have to wash our hands. So it is a very false idea. Grown, they help to protect us from fluid generated from the patients. So if we wear a proper gown, the chances of spread of infection become considerably lower. Then facial masks, facial shield, goggles, all these prevent the spread of infection to the operator via mucous membrane of the eyes and oral cavity, or mucous membrane lining the nasal cavity. So how we are supposed to put the PPE? First, we should know what are the components of PPE. Component of PPE, it consists of gown, head shield, gloves, and sometimes sanitizer or other auxiliaries. We should wear the gown first, then it should be followed with masks, an N95 mask or surgical mask, and after that we should use eye protective goggles. Then we should wear masks, these gloves. And what is doffing of a PPE? Doffing of a PPE is nothing but the removal of PPE. Is known as doffing of a PPE. So it follows the procedure or steps. First, we have to remove the gown. Then we have to wash our hand. Then we are supposed to remove the marks, followed by the eyewear, and again hand wash. So according to the research journal N95 or medical masks, which one provide better protection for the healthcare worker. So both provide significant amount of protection to the user or wearer, and N95 is suggested for the healthcare worker which are dealing with actual positive COVID-19 patients. So medical masks. So medical masks, it helps to protect the medical practitioner, dentist, or any other specialty and medical worker from COVID-19, as it consists of 3 layers. First is hydrophobic, which means they will repel the water, means the sneeze or the liquid cannot enter. Then second, we have a thin layer which will filter out the virus particles, and the third is hydrophilic, means it will be comfortable for the patient to wear. N95 respirator. So many of the people think N95 is better than 3-layer surgical masks. So what is the actual concept for scientific reasons? So N95 is a type of mask which has the capability to filter the particulate matter, which is 1 micron in diameter, and its efficiency to filter is 95%. So N95 denote the efficiency and the effectiveness of the mask. For some of the aerosol generating procedure like scaling, then using aerator should be avoided if possible. And if the patient want to do the procedure, and if it is very much necessary, then we can suggest for RT-PCR or TrueNet test, so that we can treat the patient successfully. Then performing some of the respiratory shield or wearing the mask, first we should put the mask and we should press the metal strip around our nasal area so that it will fit properly and it will protect the patient doctor from the COVID-19 and other infections. So requirement of PPE. The PPE should follow the SOP or the recommendations of the WHO World Health Organizations. So use of PPE according to level of care. So what are the procedure we are going to do? Collection of a sample for laboratory diagnosis. It should be done with PPE and other protective gears. Then suspected case, we are supposed to use PPE, and for the procedure which will generate aerosol, we are supposed to use PPE. So in summary, the use of PPE for healthcare workers required an evaluation of the risks related to the healthcare activities. The following precautions are recommended for the care of the patient with suspected or confirmed COVID-19. So for any suspected or confirmed case of COVID-19, standard precaution plus prevention of contact using barrier and the droplet precautions using N95 masks and other suitable surgical masks. Or for any suspected confirmed cases of COVID-19 or AGP, aerosol-generated procedure, standard plus contact plus airborne precaution should be taken up. Then we may ask the question, what are airborne precautions? Airborne precautions, For example, use of high suction to suck out the aerosols, then use of table fan directed towards the patients. These are some of the steps, and proper ventilations. These are some of the steps to control the COVID-19. So this is from World Health Organization, and these are my reference. So now Google's, they help to update the latest knowledge, and it is a future. Google is the future, I would like to say. Thank you very much for your kind patience. Any questions you can forward. Any questions?
So we had one question, Ms. will take.
Thank you so much, sir, for such an informative webinar. And I want to ask you some questions, sir. Sir, please tell us something about corona vaccine.
Corona vaccine currently India and other USA, England, they Oxford, so they are also proposing RNA-based corona vaccine. Then USA, Pfizer company, they also propose. So all are in the research stage. So for development of a vaccine, it took nearly more than 5 years. Why? Suppose if I develop a vaccine, so I should know that it is safe for the human, right? So it will be first trial to
Yes, yes.
mice and other mammals. Then it will be upgraded to
Yes, sir.
like monkey and all. And then
Yes, sir.
then we will know that this is safe, right? Then the clinical
Yes,
phase
sir.
1, phase 2, phase 3, right? So in the
Yes,
current
sir.
scenario, what we do is we are just avoiding everything and we are just coming directly to clinical trials. So the disadvantage of is recently some of the flu vaccine, they kill more than 40 patients in South Korea.
Yeah.
So these are the risks. So we are not supposed to be in hurry. COVID-19 is not something which is going to kill normal person
Exactly, sir.
immediately. So it's like seasonal flu. The thing is, the rate of transmission is very high, and it
Yes, sir.
should be dealt as a common flu. Respiratory hygiene, number one, personal hygiene with hand hygiene. Many of the
Yes, sir.
doctor forget this. They think that it is psycho. No, it is not psycho. It is protecting. We should be proud of it. We should proud of respiratory hygiene. We should be proud of our hand hygiene, and we should be proud of our profession. Any questions?
Yes, sir. Sir, someone asked that I heard a case of a family who didn't go out anywhere, nor history of travel living in a contaminated zone, but suddenly caught COVID-19. One person was totally asymptomatic but COVID-19 positive. How it is possible, sir? Please tell us.
It is possible through format transmission. For example, they may order a parcel pizza or something like that, eatable food. So during that time, they may get contacted. And 70% of the time, the patient will
Yes.
be asymptomatic and it will be normal. But 30% of the
Yeah.
time, the patient will be symptomatic. And if the patient is having comorbid, for example, heart patient who is taking AC inhibitor, so they are more prone to the collapse of the lungs, or what to say,
Yes, sir.
they are more higher chances of what to say morbidity. Otherwise, normal
Yes, sir.
person, I personally treated more than 10% patients including MDS, periodontist, pedodontist, through telephone or telemedicines. So they recover successfully within the time gap of 2 weeks. So they all develop all the change in taste, then dysphagia, then loss of smell, then temperature around 100 to 204 degrees Celsius. So I give normal paracetamol, I give normal vitamin zinc. It has been found to be very useful. Vitamin D3, vitamin C. So these are some of the precautions, some of the ways to boost our immune system. So if our immune system is strong,
Yes.
we are very careful regarding our hand hygiene, regarding our respiratory hygiene. Many of the patients, they don't know how the techniques. I will demonstrate you. For example, if I want to sneeze, I should use my elbow. This is called elbow technique. I have
Yeah.
to use this and I have to sneeze here. So what happens? It prevents the spread of infection. It may be corona, then H1N1 influenza or any other influenza. Suppose if I'm using my hand, then if I sneeze, my hand is full of virus, right? So with this, if I touch any other
Yes.
door, knob, anything, any other thing, then there will be spread of infections. So these are the respiratory hygienes and hand hygiene. We should carry a small bottle of hand sanitizer of percentage 60% to 70% ethyl alcohol or 65 to 70% isopropyl alcohol. These are the recommended hand sanitizer. And unfortunately, some of the people, they are using methyl alcohol. So methyl alcohol is very dangerous. They may cause blindness and they are very toxic in nature. So they are also known as wood spray and it should be avoided if possible. And the N95 marks, it is good,
Yes, sir.
but the problem with N95 marks is it can be used for around limited amount of time. For example, 10 hours, 12 hours, 15 hours. So if it exceeds, then it may create problems. So in our hospital, we face a problem. So one of the security person, he is wearing PPE N95 mask with cartridges. Then suddenly after 10 hours of duty, he fainted. Then when I observed his PO2, it was below 80. So he suffered from hypoxia. So the good point about 3-layer surgical masks is there is less chances of hypoxia, and we can wash with normal detergent. We can dry it and we can use it properly again. So it saves the cost and it is more comfortable for all to implement.
Okay, sir. Thank you so much, sir, for such an amazing session. And now, at last but not the least, I would like to request Dr. Anmol ma'am to conclude the session.
Good evening, everyone. Thank you for being with us from India and all parts of the globe. I'm wishing you all a very happy Diwali and all the happiness. Thank you so much, sir, for delivering such an informative lecture. It was a need of an hour to know more and more. In this pandemic, a little information is also of much help. Thank you for giving us your valuable time. Thank you. And I would also like to thank the host and the co-host, Astasha and Ms. Ba, for such an amazing hosting session.
Thank you.
Thank you, sir.
If there's any question, you can definitely forward. We have around.
Sir, all the questions are mostly covered in your lecture. We had few questions in the comment section, but they are almost covered in the session. So we didn't take up that questions because you have solved most of the queries in your lecture.
Okay. So what to say? In summary, I want to advise, suggest to all of the colleagues to be careful because prevention is always better than cure. Once we got COVID-19, it is loss of time, money, and burden to the family. So it is always advisable to be in a preventative readiness. For example, if somebody sneeze, and if I wear an N95 mask or 3-layer mask, surgical mask, the amount of exposure will be less. So our body can generate the antibody within a few period of time, as the amount of viral load is less. And if we are not using our protective gears, for example, masks, then the viral load will be more. So it may lead to death, not even death of the doctor or other normal person. So we have to be very careful regarding this. Thank you very much.
Thank you, sir.